Good afternoon. My name is Michelle Lane. I am the Senior Director for Community Health and Wellness at North Kansas City Hospital. We are so grateful that you have joined us today for an informative and empowering session on heart failure medications offered by North Kansas City Hospital Merita Health. This class is designed to provide you with a clear understanding of the medications that play a crucial role in managing heart failure. Our session today will be led by Hallie Stolte, a PharmD and a clinical pharmacist that specializes with cardiological and neurological progressive care. Hallie works closely with heart failure patients in the inpatient setting, helping them manage their condition effectively. One of the most exciting aspects about her career is that she has become the very first pharmacist in the state of Missouri to be certified for heart failure treatment just this last year. In this class, Hallie will break down the different types of heart failure medications, explain how they work, and discuss the importance of adherence to your treatment regimen. Whether you're new to heart failure management or sinking deeper into your understanding and knowledge, this class is tailored to meet your needs. I am so excited to be learning from one of the leading experts in this field. Welcome, Hallie.
Thank you. Thank you, Michelle. I'm excited to be here with you guys today. Before we get started, I want to give you a roadmap of where we're going to go today with this presentation. So first, we're going to talk about the commonly prescribed heart failure medications, the benefits and risks of taking these medications, as well as side effects that you can expect while taking them and when you should call your doctor. Lastly, I want to go over some adherence tools and explain some of the cost savings options that are available to you. Before we get into medications, I want to briefly review what heart failure is and what ways medications can help. Heart failure is a chronic condition, meaning that it lasts over time. It's not acute like a common cold that would go away. It's a progressive condition also, so if not treated, symptoms can get worse over time. When heart failure occurs, what's happening is that the heart muscle is weakening and its ability to pump oxygenated blood through our bodies lessens. The heart and body will try to compensate for this in the beginning stages of heart failure, but as the condition progresses, symptoms will start to get worse. The symptoms you might feel if you have heart failure are fatigue, shortness of breath, and fluid that builds up, which is also known as edema. Medications in heart failure are used in combination with lifestyle modifications, things like getting light to moderate exercise, reducing the amount of sodium in your diet, and cutting back on alcohol and tobacco products. When we use medications in combination with lifestyle changes, we find that heart failure medications work on a variety of organ systems to stop or slow the progression of heart failure, even if you have no symptoms yet. They can also reduce symptoms of fatigue, shortness of breath, and swelling from that extra volume. And maybe most importantly, they can keep you out of the hospital and keep you alive longer. So in this chart is nearly every medication we could prescribe for heart failure, and it's a lot. The good news is that most people will not be on every single one of these medications. We use a combination that's tailored to how your body reacts to the medications to find what works for you. So in the first column of this table is the medication class, which I want you to think of like a family of drugs that work in a similar way. In the second column, we have specific examples of drug names that you can refer back to see if you are on a medication in one of these classes. Keep in mind that these medications might look familiar to you if you were on them even before you were diagnosed with heart failure, as they're used for things like high blood pressure, diabetes, or abnormal heart rhythms, specifically AFib. So it can be useful to review these medications for reasons outside of heart failure as well. Okay, let's take a closer look at each medication class in more detail. Again, I'm going to talk about some of the benefits you can get from these medications and side effects or risks and how to know if you should call your doctor. The first three drug classes we're going to talk about are pretty similar, so you would only be on one medication from the first three slides here. Your doctor is going to decide which is best for you based on how your body reacts and any side effects you might experience. So the first class we're going to talk about are ACE inhibitors. Common drugs from this class would be lisinopril, enalapril. See how they're all ending in that pril ending, P-R-I-L. That's a helpful way to recognize if the medication you're on is an ACE inhibitor. In heart failure, ACE inhibitors lower blood pressure by widening blood vessels, which reduces the workload on the heart and allows it to pump more effectively. In clinical studies, patients who had heart failure and were put on an ACE inhibitor actually had reduced risk of death and hospitalization due to their symptoms than patients who were not on an ACE inhibitor. You're going to hear me saying this phrase a lot in this presentation because almost all of the core therapies we use in heart failure have this same benefit. Some side effects that you may experience if you are on an ACE inhibitor would be dizziness or blurry vision, and these can be signs that your blood pressure might be too low. So it's important to talk with your doctor and potentially decrease your dose if your blood pressure is getting too low. But some things you can do in the meantime is try and take time when you're having position changes. So if you're going from laying down to sitting to standing, make sure that you're going slowly to give your body time to adjust to those position changes and your blood pressure to follow with you. ACE inhibitors also come with a chance of developing a dry, bothersome cough, kind of like a hacking cough. And this is due to the way that it works in our body. It can occur hours, even months after taking an ACE inhibitor. So if you have this side effect, talk with your doctor because we can change you to a different medication that does not have this. And lastly, ACE inhibitors can cause something called angioedema, which is a rare side effect, but it can be dangerous. So I'm going to talk a little bit more about that on this slide here. Angioedema is a technical way of describing swelling that can occur in the head, neck, think lips, tongue, throat, airway. And since that swelling can occur in your airway, that's what makes it really dangerous. We don't want to compromise your ability to breathe. So again, this is rare, but it can be serious. That's why I want to talk about it today. And it can happen with two of the medication classes we're going to talk about, ACE inhibitors and a medication class called ARNI. Both of these medications work in a similar way, which is why we see that risk associated with them. And angioedema can occur in the first week of therapy or even after you've been on an ACE inhibitor for years with no problem. And it can also occur after you've already stopped taking it. So if it comes up after you've already switched medications, it may still be due to the ACE inhibitor being in your body, being in your system. If you smoke, if you have a history of angioedema, or if you have seasonal allergies, these things can place you at higher risk for having this side effect, but it is still rare. If it does occur, you should seek medical attention right away by calling 911 and letting your doctor know that this happened to you, as you should not continue to take an ACE inhibitor or ARNI after having angioedema to 1. So switching gears, our next class is going to be called ARBs for short. It stands for angiotensin receptor blockers. And if you notice, these all end in sartan, losartan, valsartan, olmesartan. That makes them easy to recognize. They work very similarly to ACE inhibitors, so they also reduce the workload on your heart in heart failure. And again, they've been clinically proven to keep heart failure patients alive longer and out of the hospital for heart failure-related reasons. The side effects are, again, similar to ACE inhibitors with those signs of low blood pressure like dizziness or blurry vision. But since ARBs work slightly differently, we can forget about that dry, bothersome cough, and we can reduce the risk of angioedema by switching to this medication. So if you're on an ACE inhibitor and you have a dry, bothersome cough, or if you've experienced angioedema before, talk with your doctor and see if switching to an ARB is a good idea. And the last of the 3 similar drug classes is called ARNI. This is a combination of a ARB, if you see the sartan in valsartan, and a neprilysin inhibitor. So neprilysin, what is that? It's an enzyme that prevents our bodies from being able to break down plaques in our arteries. So by inhibiting its action, we allow the body to naturally break down those plaques, open up arteries, and lessen the workload on the heart. Combining this with an ARB, we've seen even more benefit. So this is a new medication. The brand name is Entresto, if you've seen commercials for that. And it has shown great benefit that patients are actually being switched from ACEs and ARBs to ARNI. Side effects look similar to the other medications we've already discussed with the dizziness. That dry cough and risk of angioedema come back because of the sacubitril or the neprilysin inhibitor component of this medication. So if you experience side effects on an ARNI, switching to an ARB by itself may be beneficial. Okay, moving away from our ACE inhibitors, ARBs, and ARNIs, we're going to talk about beta blockers. These end in OLOL, so metoprolol, carvedilol, bisoprolol. And they are used for a variety of conditions such as high blood pressure, abnormal heart rhythms such as AFib, and even performance anxiety symptoms. However, for the treatment of heart failure, only 3 beta blockers are on the market, and it's the 3 that are listed in the top corner of this slide. Beta blockers will work by relaxing your heart, allowing heart function to improve over time. And they can actually protect your heart from going into a life-threatening heart rhythm that can happen in severe heart failure when the heart muscle has gotten very weak and is very worn out. The 3 beta blockers that we use in heart failure have been shown to reduce the risk of death from heart failure and hospitalizations due to heart failure symptoms. I have a few side effects listed there, but I'm going to use this next slide to go into a little bit more detail on the side effects of beta blockers. So we have fatigue, sleep disturbances, or insomnia. Since beta blockers work by relaxing your heart, you may also notice a lower heart rate, a lower blood pressure, and fatigue. This is typically only going to happen for about 2 weeks after you start or increase a dose of a beta blocker. After that, your body's going to get more used to the medication and kind of understand that it is relaxing your heart and allowing your heart to get stronger on its own. If you have diabetes, I want you to pay close attention to this next bullet point. Remember when I mentioned that beta blockers ease performance anxiety? Those also match the symptoms of low blood sugar. So think about how you feel in front of a large crowd. That may be how you feel when your blood sugar is low, which is more common in diabetic patients. And beta blockers are going to mask those signs and symptoms. So you won't feel tremors, shakes, palpitations, or irritability. The only symptom that you will have from a low blood sugar would be sweating. So if you are diabetic and particularly on insulin and taking a beta blocker, be sure to watch for sweating as a sign of a low blood sugar and test your blood sugar regularly. Okay, next up is one of the newest medication classes coming to the heart failure world. It's SGLT2 inhibitors. These medications end in gliflozin, which doesn't exactly roll off the tongue, so we tend to refer to them by their brand names. The 2 most common ones used in heart failure are Farxiga and Jardiance. I'm sure you've seen a catchy jingle as they have a commercial on almost every cable TV break these days. But SGLT2 inhibitors have actually been around for quite a while. They're originally used for diabetes, and the medical world is still really not quite sure how or why, but clinical trials have shown that they benefit patients with heart failure. So why would we even look at a diabetic medication for working on your heart and helping with heart failure? It's actually kind of an interesting story, but maybe just to me as a pharmacist, but I'm going to tell you it anyway. There's actually a class of diabetic medications around many years ago, and patients were on them for a long time before we started to notice that they were having more heart attacks, more diagnosis of heart failure on this medication class than patients who were not. After this discovery, the FDA decided that any new diabetic medication had to include in their clinical studies side effects or safety parameters around cardiac disease states. So specifically looking at a diabetic medication in a patient who may be at higher risk of having a heart attack or being diagnosed with heart failure, and making sure that they weren't causing harm. So when SGLT2 inhibitors underwent their clinical testing, instead of just showing that they didn't harm the heart, they actually showed that they helped it. So we took over in the cardiac world, we took over this diabetic medication, and it is now indicated for anyone who is at risk of having heart failure or having heart failure. They've been used very increasingly in the past few months because of how great they're working and how few side effects they have. So generally well tolerated. If you do have diabetes and heart failure, you're more likely to have side effects, as the drug's side effects are known from the way that it works in diabetes. So urinary tract infections are more likely because in diabetes, these medications work by removing sugar through the urine, which makes you more prone to infection. And your doctor may advise you to stop taking your SGLT2 inhibitor if you aren't eating or drinking normally, maybe around a surgery before you go to surgery. This is to prevent a rare side effect of SGLT2 inhibitors called ketosis. Okay, so obviously that's my favorite drug class. It's new and exciting, but we'll go back to some of the more routine ones. Aldosterone antagonists are a class of medications that we use that act on hormones. Spironolactone and eplerenone are the two options. Spironolactone would be the more common of the two. So they're going to work to help the kidneys flush out salt and water. They're going to lower blood pressure so that your heart doesn't have to pump as hard. Aldosterone antagonists have been shown to reduce the risk of death in heart failure, but they don't have that other caveat of reducing hospitalizations due to heart failure. So they didn't quite get to show that benefit, but they're still a great class of medication for heart failure. Side effects of aldosterone antagonists include dizziness because they're going to help lower that blood pressure. And one unique one that is associated with spironolactone is swelling or tenderness of breast tissue in both men and women. If you experience this side effect, it's more common with spironolactone and pretty rare with eplerenone, so talk with your doctor and see if you can switch. Since aldosterone antagonists are going to help you flush out water and salt through your urine, symptoms of dehydration can be important to watch for. This would include things like drier mouth or having muscle cramps. Make sure that you stay hydrated while you're taking this medication and have your labs tested so your doctor can monitor your electrolytes. And finally, we're going to talk about diuretics. These are more commonly referred to as water pills. And they're going to force the body to flush out extra fluid through urination, which will provide you symptomatic relief while lessening the workload on your heart, so making you feel better. Unlike the other medications we've talked about today, clinical trials have not shown that diuretics benefit mortality, so keeping patients alive longer, and they have not shown to decrease hospitalizations due to heart failure. The only thing that we have seen from diuretics is that they make people feel better. So when we reduce the fluid buildup by excreting it out in the urine, less fluid means less swelling, it means easier movement, and it means less shortness of breath. Diuretics come in a tablet you can take by mouth or an injection that we can give IV. So your healthcare team can adjust your dose based on your symptoms and find what works for you. If you're having severe symptoms of heart failure, we can even give you an IV higher dose to help you get through that. Side effects of diuretics include dehydration and low blood pressure. So you're going to be urinating more frequently, you're going to be losing more fluids, so it's important to keep an eye on your hydration level. Your doctor is going to monitor your electrolyte levels if you take a diuretic, and if any of them are low, they may prescribe you a supplement like a potassium supplement. Electrolytes are important to monitor because if they're too high or too low, they can place you at risk of having an abnormal heartbeat that could be life-threatening. Be sure to take your water pills appropriately. Taking them in the morning and early afternoon, say no later than 3 p.m.-ish, will allow your medications to work during the day instead of kicking in overnight and having you make multiple trips to the bathroom when you're trying to sleep. As I mentioned, diuretics come in an oral tablet and an injection form, and new technology is evolving and changing every day for patients to manage their symptoms. One of the newest developments is this wearable device. So what it does is it sits on top of your skin and has a small needle that is inserted, similar to a CGM or a Dexcom, if you've seen one of those. And what it's going to do is it's going to deliver a diuretic, furosemide, subcutaneously, just under the skin, continuously. So if you've ever been called into the hospital for a short-term IV dose of diuretics, this device could replace that, and you can do it from the comfort of your home. It's not for chronic use, so you won't wear it all day long and not have to take your diuretic pills. It's more for that acute stage of heart failure where you have volume overload that is not able to be managed with oral medications. But it can save you a trip to an infusion clinic or a trip to the hospital. Some additional medications listed on this slide are also used in heart failure. I'm not going to go into much more detail about these as they're typically added on to core therapies that we've already discussed in very specific circumstances. But if you have questions about any of these, I'm happy to go into more detail during the Q&A session, or I'll provide my email and we can chat more online. As a reminder, because I wouldn't be doing my job as a pharmacist if I didn't say this disclaimer, always talk with your doctor or pharmacist before starting, stopping, or changing your medications. Let your healthcare team members know if anything changes about your medications, if you take any vitamins, supplements, or herbal products, so that we can make sure all of your medications are playing nicely together. Okay, let's switch gears a little bit and talk about some tips and tricks to stay on track. So adherence, or taking your medications as prescribed every day, is an important step to keeping your heart failure from progressing. Make sure you know when to take your medications, if you should avoid taking them with any other medications, and what to do if you miss a dose. Your local pharmacist can help you go through your medication list and answer these questions, and make sure that you have a plan to stay adherent. In this day and age, there are many different products and technologies available to help you stay on track. Each has its pros and cons, and there's no one answer that fits everybody's lifestyle. So I'm going to go through a few options we have, and trial and error can help you decide if one of them works for you. You can find the tools that we talk about today in most retail pharmacies or from online retailers like Amazon. So first is the tried and true pill box. They come in many different shapes, sizes, amounts of slots that you can fill up, and they can help you remember if you took your pills for that day, because if you did, they won't be in the slot anymore. They even make a lockable timed pill box that you see in the bottom picture here, and they can be fitted with alarms to remind you to take your medications. I've seen this be useful for caregivers who are filling pill boxes for loved ones with dementia who maybe don't know to take their medications or try to get into multiple days worth of pills at a time. This will keep it locked and secure and make sure everyone stays on track. Some cons of pill boxes is that medications, some of them that you may take, shouldn't be removed from their original packaging, like nitroglycerin. Nitroglycerin is also a as-needed medication. If you have chest pain, you may have a prescription for this. So you wouldn't want to fill it in your pill box and put it in every single day if you only need to take it as needed. The other one is that we need to be cautious if doses change, because once you put all your pills into this pill box, it can be difficult to sort out which little white pill you need to take out and replace with a higher dosage. And lastly, they do take time to refill. So depending on the size of the organizer, you may be filling this up every week. Another option is prepackaged systems. These are commonly called blister packs. I've got a picture of that you may get from a pharmacy at the top, and then the bottom photo is a company called PillPack. So these are typically ready for use that come from a pharmacy or a mail order supplier. The PillPack picture here it gives you a little baggie. They're all connected together, and they will give you your Monday morning meds, your Monday afternoon, your Monday night, followed by Tuesday morning, Tuesday afternoon, Tuesday night, or however often you take your pills. They will give you a packet for each section of the day that you should be taking meds. So all you have to do is rip it open and take them. These can be convenient because the work is already done for you. The medications are secure. They're protected from light, protected from air. And you know if you've taken that day's dose because the pill is not in the slot. However, again, if a dosage changes, you may need all new packaging, or you may need to be able to sift through the pill pack and find which pill you need. Okay, so another thing to avoid is making sure that you keep your medications out of reach of pets or children's to avoid any accidental ingestions. I want to remind you to refill your medications early or set up an autofill with your pharmacy so you don't run out of medications. And avoid storing your medications in the bathroom. Heat and moisture from, say, a hot shower can decrease how well your medications work. All right, our last section for today is cost savings, because who doesn't want to save some money at the pharmacy? On the next slide, I'm going to show you a table of a few different cost savings options, and it is a lot of content, so I don't want to overwhelm you. I'll preface by saying that not every option will work for everyone, but I don't want that to stop anyone from starting the conversation with their healthcare team about the affordability of their medications. Okay, so here it is. It's got 4 different savings options that are available. We're going to discuss which ones work for who, what they are, and any restrictions that may apply. The first one is a pharmacy $4 list. These became popular several years ago when pharmacies started negotiating with their suppliers to get medications at a discounted cost if they were available as a generic. So medications in this $4 list may cost you anywhere from $4 to $15 for a 1 to 3 month supply. Keep in mind that the medications do have to be generic. So a branded only drug like Entresto or Jardiance is not going to be on one of these lists. And you cannot combine it with your insurance. If you are wondering if one of your medications may fall on a $4 list, you can ask the pharmacist at your retail pharmacy if they have one. I know certain retail pharmacies do like a Price Chopper and Walmart. While Hy-Vee and Costco, they offer like a percentage off. So it may not be $4, but it will be a discount on generic medications. You can also Google generic $4 lists and see if any pharmacies have that. Next cost saving option is a manufacturer savings offer. So these are a good option if you have commercial insurance, but you find that your copays are still a bit pricey. Typically, these are funded by drug companies. So you can go to their drug company website, just Google the brand name of the medication that you're on, and there should be a menu option, something like savings and support. When you click on that menu option, it should bring you to a list of options based on what kind of insurance you have. Typically, these are going to apply to commercial insurances. There is not a lot of good options for government insurance, such as TRICARE, DoD, Medicaid, or Medicare, but some companies do offer it, so it's worth taking a look. They also sometimes limit an annual amount you can use per year on the copay cards. So it's important to make sure you're not going to run out before the end of the year. Next is a little similar to manufacturer savings options, and these are called patient assistance programs. Again, they're sponsored by the drug manufacturer, but they can provide discounted or free drug supply to patients that are enrolled in the program. This one is best to go through your doctor's office and ask them if they know of any patient assistance programs offered on a specific drug for you, because they're going to have to fill out an application, and then you're going to have to fill out an application and make sure that you meet the eligibility requirements like citizenship. There's an income requirement, insurance type. It's different based on which drug and which manufacturer puts on the program. So they can help you get started with this in your doctor's office. And lastly, we have a popular savings option, a discount card. If you've ever heard of GoodRx, this is a good example of what a discount card is. Others are called Single Care, Blink Health. These companies are providing cards that have negotiated prices with specific pharmacies or drug companies to be able to offer a discount on the cash price of a medication. So discount cards are free to use. Some may have a paid membership where you get additional savings or perks, but keep in mind that these cannot be combined with your prescription insurance. So if you have a copay from your insurance, it's highly likely that a discount card is going to end up costing you more money to use because it's going to revert out your insurance and only take a discount off the cash price of the drug. If that doesn't make much sense, I'm going to do a quick example here. So let's talk about Jardiance, which is an SGLT2 inhibitor and one of the new class of medications we're using for heart failure. So it can still be a little expensive. Since it is a brand only, it's not going to be an option to use a $4 list at a pharmacy because those are only on generic medications. We do have some pretty good manufacturer savings offers. So there is a copay card that's going to bring copays down to as little as $10. Again, there may be an annual cap on how often you can use that or how much it's going to contribute to your copay. And they even have a Part D copay help. So if you find that your copay is still high with your Part D program, they may be able to help you, but there's more restrictions on that than with the $10 copay card, which would be available to anyone with commercial insurance. Jardiance also has a patient assistance program available for uninsured or underinsured patients, but you do have to meet their income requirements based on household. So you would have to either provide pay stubs or your social security information to the drug company when you apply for this patient assistance program. And lastly, we have the discount cards like a GoodRx. If you look at these prices, it's going to take you down to about $500 to $700 for a 30-day supply of Jardiance. So if we think about this on a larger scale, the cash price of Jardiance is about $750 a month. So if you are uninsured, your best option would be for a patient assistance program to try and get free supply from that drug company, unless you do not meet their requirements, in which case a discount card is still a pretty hefty price tag, but it is taking about $100 off the cash price. On average, copays from commercial insurance for Jardiance are about $0 to $50 for the majority of patients, but some can pay up to $175. So if you did have a $175 copay per month for Jardiance on commercial insurance, I would say a copay card would be the best bet for you. So this is just a general example. It's going to differ for every patient and every lifestyle, but just know what options are available to you to help you make a smart decision when you're at the pharmacy. You could be saving money on your drug costs and staying adherent to your medications. So let's recap what we've talked about today so far. This table is the one we saw earlier of possible medications you could be on for heart failure, but I've bolded the ones that have been shown to reduce the risk of death or hospitalization due to heart failure symptoms. And it's all of them except diuretics. But remember, diuretics are still important because they're going to make you feel better. You're going to have more mobility, less fluid buildup. So all of them are important, but I really want to drive home that these medications are clinically proven to keep you alive longer and out of the hospital. So in summary, it's very important that we make every effort to stay adherent to our medications. There's many different meds you could take for heart failure, and medication selection is going to be aimed at minimizing side effects while maximizing your benefits. If you have your doctor or your pharmacist available to help you overcome any barriers that you experience, that's what we're here for. So I want to encourage everyone to have a discussion with your healthcare team if you have issues with side effects or if you have cost barriers, and see if there's anything that can be done with your healthcare team. So that's all the information I have. I want to thank everyone for your attention and your attendance, and I'm happy to take any questions. If you're not comfortable talking in a group setting, I've added my email here and I'm happy to chat privately.
Thank you. That was so good. That was actually one of the best ones I've heard in a long time. And we've got a couple questions here, if you don't mind. So one of the questions they wrote in is, I am on aldactone for hormonal acne and have been for years. I know this is off-label. Is there consequences for being on one of these medications long-term?
So generally, no. And for the hormonal acne, the dose is probably a little lower than what we use for blood pressure or for heart failure. So you should have less side effects, but it is important to still monitor labs routinely because we don't want to have low electrolytes or signs of dehydration that maybe you're not feeling. So make sure you're getting your yearly labs or however often your doctor is recommending them.
Okay, that's a really good answer. And then we also have another question related to Jardia, the new medication that you were talking about.
Mm-hmm.
This person asked, did you say ketosis isn't that a good thing? Doesn't that help in weight loss? And is this medication being studied for weight loss then?
No, it's a little different. It's ketoacidosis. So it's the keto diet is when you try to limit the amount that you're taking in so that your body is in ketosis and burning off that fuel. But when it happens as a result from this medication, something can happen similar to DKA. If you're diabetic, you may have heard of that before, diabetic ketoacidosis, which can be life-threatening if it gets too severe. So it's different. It has a lot of different factors, but your body is basically in an acidotic state, and you don't have from SGLT2s the sugars to help you out. So your blood sugars will be low, but you'll be acidotic.
Okay, that makes absolute sense.
It's a tricky one to answer in like
yeah, that is a tricky
way.
one. That is good. And so my own personal question, I have told people that are put on beta blockers for a long time, sometimes people are symptomatic. Even my neighbor recently, just feeling really tired and lethargic the first week or so that they're on it. And historically, I've told people that as that medicine becomes therapeutic in their bloodstream, that the symptoms will die off or will lessen.
Yeah. Yeah.
Am I telling people incorrectly, or
yeah,
is that
no,
okay?
I agree. Yeah, I agree with that. It's like I think generally 1 to 2 weeks they should start to feel better. It's kind of like your beta blockers blunting your body's ability to like get excited. Or if you think about it from a performance anxiety standpoint, where you start to feel like, oh, I'm really nervous about this presentation, a beta blocker is going to blunt that. So you do feel tired, but you can get over that in the first 2 weeks of taking the medication is when it's the worst, I would say.
Absolutely wonderful. All right, let me check one more time to make sure we got all the questions, but you did a wonderful job, and this was really important information. So thank you so much for your time. And thank you everybody for joining us today. Next week, we have got a lunch and learn with Dr. Werner, where you can learn all about interventional radiology and how it can empower and improve your health. So thank you much for joining, and everybody have a great day.
Thank you.
Bye-bye.
Bye.